Hello, my name is Kathleen Finnan, and I am here to talk about idiopathic toe walking in children. I'm a physical therapist at the Cleveland Clinic Children's Hospital for Rehabilitation. I am a mother of identical twin girls, age 22, and a son that's 16. I graduated from Marquette University in 1995. I'm a pediatric physical therapist at the Cleveland Clinic Children's Hospital for Rehabilitation since 2001, and I'm a native to the west side of Cleveland. I'm passionate about the health and well-being of all children. What is idiopathic toe walking? Toe walking is a pattern of walking on the toes without placing the heel or full foot on the floor. A child may be able to lower their heels when asked, but will rise up on their toes if not being reminded to walk with heels down. Some children won't be able to get their heels down far enough to make contact with the floor when asked due to tight heel cords. Toe walking is referred to as idiopathic, meaning there's no known reason or pathology causing it, such as cerebral palsy. The definition of toe walking is children 2 years and older who have toe walked for more than 6 months and for greater than 50% of their day. Although the majority of toe walkers are otherwise healthy children, it is important to approach each case with a high index of suspicion, as toe walking can be due to a structural problem, such as a contracted tendon, compensation for a short limb, or a manifestation of autism spectrum disorders, cerebral palsy, muscular dystrophies, or other neurological or neuromuscular conditions. In typically developing children, consistent heel strike during initial stance phase of gait occurs by 18 months or at a mean time frame of 22.5 weeks, or about 5 months after the onset of independent ambulation. So after they start walking, we should start seeing them get their heels down about 5 months after they start walking independently. This is a video of a typically developing baby, age 14 months, and he's been walking now at this point for about a month. As you can see, he can squat down nicely and then stand back up. Kind of walks with like a foot flat gait, not really getting true heel strike yet, which we wouldn't expect him to do by now because it's only been a month. Squats down again and stands back up, able to turn, stop, stand still, look up at his mother, and do all of these things without a loss of balance. So this would be a typical gait or walking pattern that you would see in a new baby that just started walking. It is estimated that toe walking not associated with cerebral palsy occurs in 7 to 24% of the childhood population. The prevalence of toe walking at age 5.5 is 2% in normally developing children, and much higher, 41% in children with neuropsychiatric diagnoses or developmental delays, with a slight male predominance. Idiopathic toe walking has been associated with speech and language delays, abnormalities in executive functioning, social skills, learning, and memory. It has been suggested that a sensory processing dysfunction can cause toe walking. This is a video of a baby a few months older than the previous baby, and he as well has only been walking about a month, and he's 19 months old at the time of this video. As you can see, he's up on his tippy toes with every step. He doesn't get his foot flat on the floor. Those heels never touch the floor. And he's on the move. He doesn't really stop and stand still. It's difficult for him to stand still and get those feet flat without falling. So he's a few months older than our previous baby. So he actually started walking, obviously later than the previous baby, um, later than when we would have wanted him to start walking, but he is walking nonetheless. But you can see this type of walking is not really something we would want to see, that he's obligated to be up on those toes the entire time, and he's unable to stop moving. He has to keep moving to keep his balance and his body up against gravity because he doesn't have the balance in his ankles to stop and stand still without losing his balance. So there he's holding onto the chair and he was able to stop, but he had support from his hand. So now he's tired. He has to take a break, not a long one, and he's up and moving again. And off he goes. So if he wants to stop and take a break, he has to lower himself to the floor because just standing still for him is too difficult. Down he goes again on purpose to take a quick break because he's getting fatigued. He needs a break, but he wants to keep walking. And there he goes. What's all the fuss? Children who toe walk are at risk for pain, decreased strength and endurance, gross motor delays, balance problems, difficulty with wearing shoes. If you look at the bottom of your children's shoes, you'll notice that on the forefoot or where the toes are in the shoe, it's really worn down, but the heel looks like it's a brand new heel and never been walked on. Tightness in their heel cords leading to muscle contractures, sometimes requiring surgery to alleviate the contractures in order to get their ankles at a good range of motion. Bullying or teasing by other children. Oftentimes, the children who walk on their toes will be the ones that are taking a break and watching everybody else play because it's physically quite demanding to walk and run and play on the playground and keep up with all the other children. So you might see your children needing more frequent rests. Postural alignment abnormalities, orthopedic and joint problems in their hips, knees, and ankles. This is another video of an older child who also walks on his toes. He's 8 years old. Almost lost his balance when he was asked to be still. There he is, every step, up on his toes. Same thing here. And you'll notice that he has his hands in his pockets because that gives him a sense of stability and some sensory input as he's walking. Almost lost his balance. We see those heel cords are quite defined and quite tight, as you can notice from looking from the back. every step. So at this age of 8, we would expect a child to have a fairly mature gait pattern, an adult-like gait pattern, with a heel strike first. And clearly this child is unable to get his heels down, even his foot flat on the floor as he walks. What should a parent do if they're concerned their child toe walks? Talk to your pediatrician about it sooner rather than later. 8 years old is kind of late, but we can still address it and we can still manage it. It just takes a little bit more time and effort. It is easier to address earlier on than later, ideally no later than the child's second birthday. Ask for a referral to physical therapy for an evaluation. What can physical therapy do for my child? We evaluate the child's walking and overall gross motor skill development. We make recommendations for exercises and orthotics that may be indicated for that child to improve their walking and decrease the toe walking. We make referrals to other specialists if necessary, such as occupational therapy, speech therapy, orthopedics, neurology, or developmental pediatricians. And we improve the child's walking and decrease their incidence or frequency of toe walking. What conservative treatments can physical therapists provide to my child? We utilize standardized assessments and measurements to develop a customized care plan. We provide strengthening activities to weak muscles. We provide stretching activities to tight muscles. We work on balance and developmentally appropriate gross motor skills such as jumping and trike riding. We do serial casting when indicated. If the child's heel cords are so tight, we need for them to walk in casts on a weekly basis, changing out those casts every week for over the course of 2 to 3 to 4 weeks, depending, until we can get the range of motion we need in their ankle to then transition over into traditional therapies. We help with orthotic issuance with the orthotist to optimize the child's walking. We fabricate night splints for passive stretching when the child is asleep. We do kinesiotaping, and we provide a comprehensive home exercise program, which is very important for the children to continue to do on a regular basis outside of therapy at home to make the best progress. Most of the time, aggressive interventions such as surgery and Botox are not needed if physical therapy is started early enough. The frequency of physical therapy will vary depending on the severity of the toe walking. Typically, it starts with weekly sessions and decreases in frequency as the child improves over the course of a few months. Sessions can last up to an hour, and every patient will be expected to perform their home exercise on a regular basis at home. Day orthotics that might help. This is just a rigid carbon fiber footplate that you would put under the insert or the insole of the shoe. That kind of helps cue the child to stay down because it's quite firm and rigid and would make it more difficult for them to go up on their toes in their shoe. This is like an off-the-shelf arch support that might be helpful and give them enough feedback in their shoe to try to stay down, keep their heels down and off their toes. These two are a little bit more aggressive. This is an SMO with a slightly longer lever arm here to cue the child to stay off their toes and get a heel strike. And then a little bit more aggressive with a longer lever arm, but again, trying to cue the child to stay down, get a heel strike, and break that toe walking pattern. These are two examples of night orthotics. This is a cast that we make here in therapy out of casting tape, and they would only use it when they're sleeping. They don't walk in this cast. And you can see it would provide a stretch to the ankle here overnight as they're sleeping. This is another example of a night cast or a night splint that they could sleep in. And this joint helps provide a little bit of a tension to get a stretch on the ankle while they're sleeping as well. And this one would be made by an orthotist. The goals for PT would be for the child to walk on their toes less than 25% of the time without wearing their braces or orthotics. For them to have normal strength and range of motion, good balance reactions at their ankle, age-appropriate gross motor skill development, and some patients may have to follow up with PT through puberty or growing years consultatively in order to maintain the achieved goals, assess for appropriate orthotics, and upgrade home exercise programs as necessary. Many times we have to follow the children over the course of a few years to make sure that the toe walking continues to be managed as they go through growth spurts and they continue to grow. This is just a fun video I thought I'd share with you. These two little boys are probably about 2 to 2.5 years old, and they have pretty typical gait and running patterns and not obligated to be on their toes. So these are my references. And as a reminder, just please remember to always consult with your pediatrician with further questions or email us at this email address here with any questions as well. And thank you for your time. And I hope that you guys learned a little bit about toe walking and how you can help your child if you suspect it's a problem.